Good afternoon. My name is Kenneth Marty, and this presentation is going to be about my institutional pharmacy rotation. So this summer, I was in Brandon Regional Hospital for my rotation site. I was there for about 2 weeks. The hospital is located in Brandon, Florida, as the name suggests. Basically, it's a 350 to 400 bed size hospital, and they're actually expanding their ER department. They're adding about 75 more beds to it, so that is going to expand how many patients they can see in that department. So this hospital is actually a for-profit hospital. So some of the formularies and different process and procedures that they have in place is definitely a lot or almost different from a nonprofit hospital. Some of the services that they do provide ranges from medical surgery, pediatrics. They do have an emergency department, as I stated before. They have an oncology department. They do have a psychiatry department. OBGYN, they do have a standardized ICU unit for neonatals, pediatrics, as well as adults. And they also have ambulatory care as well as antimicrobial stewardship. They do place a lot of focus in regards to their stewardship because they do want to minimize and prevent any type of infection that may occur during the patient's stay at the hospital. This semester, I was very excited to begin my institutional rotation because I had a preconceived notion that institutional pharmacists interact a lot with the patients as well as provide lots of clinical knowledge during rounds with other healthcare professionals. Expectations that I had for my rotation was that I would be going on rounds with the clinical pharmacists almost daily and helping them make interventions and recommendations to help increase patient safety. I didn't have any high expectations for my site because Brandon Regional doesn't really have the best reputation for patient care. So my expectations weren't really that high um, prior to going to the site. So I really didn't expect to do a whole lot. During my rotation, I had various activities that I had to perform, but two examples of experiences that were very important and impactful to me were rounding with the adult ICU clinical pharmacist, as well as shadowing the centralized pharmacist. Rounding with the adult ICU clinical pharmacist impacted the way I will be studying because it showed me that memorizing the minute details of a disease state and the guidelines and the treatment regimen is not the best way to apply my clinical knowledge. Because on rounds, it is important to make decisions very quickly, as well as being able to explain to other healthcare professions the reason and rationale to why a selected drug is used to treat a disease state. Also, shadowing the centralized pharmacist made me realize that institutional pharmacy is most likely not for me, seeing how there is no interaction with other healthcare professionals, nor especially patients. That is very impactful because I do like that aspect of being able to interact with healthcare professionals and being able to be on a one-on-one interactive base with the patient. So those are the most impactful activities that I performed during my time at the hospital. Other activities that I did perform were mainly inventory control based. One of my main responsibility was inventory control, having to pull medications from the shelves to complete orders and having to fill the Pyxis machines and stock in each section of the hospital. Well, this rotation has not really impacted my idea of becoming a pharmacist. However, it has deterred me from thinking or pursuing a career in institutional pharmacy. The reason is that I feel there isn't any patient interaction, and if there is, it is pretty minimal. And even if the patients are discharged, I feel like the pharmacist should at least do the consultations on their discharge medications. I feel I have a better understanding of what I want to do in the future as a pharmacist and as a healthcare professional. In all, this rotation will benefit in my development as a pharmacist and also as a healthcare professional because it has enabled me to really think about the career path I would like to pursue and undertake, and also how I can make myself more accessible to patients as a healthcare professional. So in all, this rotation has planted a seed in my head as to what I really need to start focusing on and what routes I need to take in order to achieve the goals that I want to achieve, regards to becoming a pharmacist and how I can help patients live a better life overall. Teachable moment that I had that was very significant, that I encountered during my rounds, was the importance of following up and not guessing when a clinical question is asked, and making sure to be 100% sure before suggesting or making any recommendations, because it is better to be 100% sure than to guess. And also, it is very important as a professional, to follow up with recommendations or with clinical answers to questions that may not have been known during rounds. So it is important to not only be 100% sure regards to the facts that you present, but to also be diligent in being able to follow up in a timely manner. Some of the strengths that Brennan Hospital has, one strength that they do have at this site, is that they value patient interaction and making sure the patient is aware of their treatment plans and connecting with the patient on a personal level. One thing that should be included is midpoint and final preceptor evaluation to improve the IPPE site experience. In the midpoint evaluation, it is important to make it available to the preceptor for them to gauge how well they are doing, and it is also important that it provides the preceptor an opportunity for the student to present concerns that the site can improve on in regards to bettering the student's experience at that site, and also to provide them with a more practical approach to the institutional learning experience of pharmacy. One thing that should also be considered or required to enhance the learning experience of the student is to require X amount of patient case studies, so that way the student can apply their clinical knowledge in doing patient case study workups and making a presentation on the patient and the clinical steps that the student will take to help improve the patient's care. Also, another thing that we can do as a college or overall to better the experience at this site is to improve the overall learning of the student by partnering the student up with the preceptor, and to have the student shadow the preceptor while providing the student with different projects to expose them to different aspects of institutional pharmacy. For instance, having the student work on projects that deal with enhancing patient safety and or minimizing waste of medications in a central pharmacy could be a good project with regards to how the student learns how to manage inventory control and the workflow of the pharmacy as a whole. Also, regards to my preceptor, he was very knowledgeable and experienced pharmacist who had a lot to offer. However, his position as a clinical pharmacist manager limited my access to him, thus it was harder for me to gain enough of an understanding of his role in the pharmacy. And this affected my experience at this site because it limited how much I was allowed and able to do in the pharmacy without his direct supervision and guidance. I had two other pharmacy students from LECOM and UF. We worked together even though we were from different schools and had different academic years. Since I was at my site a week before the other two students, I took on the role of sharing with them what I have learned thus far in regards to the functions of the central pharmacy and how to best pull, fill, and deliver medications, and also the best part to manage the inventory control. Last day at my site, a patient came into the ICU and was being treated for drug overdose. However, the drug that the patient overdosed on were metformin, lisinopril, and pain thinner. And the regimen that the patient was treated with was with ethylene alcohol. So basically, the ethylene alcohol was to soak up the acetone on the scale of 1 to 10, with 10 being the highest. I would rate my site experience at 6.5, mainly because I felt like an additional technician. There wasn't much that I could do was allowed to do, so that really limited my ability to apply my skills and knowledge from school. Expectations that I had for my site was that I would be at least going on rotations with the clinical pharmacists and helping them make interventions and recommendations